Actually, you know what? Why don't we go through that? What's this past week been like with you, for you, especially as we get more positive cases, coming out in Texas?
Yeah, the week has been pretty busy and um, mostly just in trying to inform the community in terms of precautions that need to be taken and how to protect themselves. And so being able to communicate that with our community has been incredibly important for our group in terms of the infectious disease specialists and tropical medicine specialists to make sure everyone is informed, but also in the clinics, reassuring our patients, providing them with guidance and making sure that they're prepared has also um, been very, very important.
Other than the basics of proper hygiene and um, knowing what symptoms to look for, what other things are you telling patients, or what other discussions are you and your doctors having about how to make sure people are educated about what's available to them during this time?
Yeah, so as we know, there's not a approved treatment or preventative measure that can be done for this novel coronavirus, the SARS-CoV-2. So prevention and preparedness is critical to protect our community. So we're emphasizing what everyone's heard: the hand washing, social distancing, making sure there's not close contacts with sick individuals, sick people, staying home and away from the community and other individuals, even within their home, staying away from public places, public transportation, things like that to make sure that there's not ongoing spread. We've talked a lot about how to cough, how to sneeze, these things that seem pretty basic, but being able to do it the correct way to help prevent spread has also been important. But other than that, making sure that people are just aware of the symptoms and take the precautions necessary.
Have you had a lot of patients asking you about testing?
Yeah, a lot of patients concerned about testing. So far, I personally haven't had a lot of patients with symptoms that required testing, so we haven't run into that issue currently, but it's certainly a concern for people within the community as to what they do, where do they go when they do have needs to get testing.
And I'll try to quickly summarize so we don't have to spend too much time on it. But when it comes to that, right, they should be calling their doctor first, right, and say, these are the symptoms that I have. You would ask them the questions about travel and so on and so forth. And if it's something more severe, then maybe they might go to an emergency room, and still it would be helpful for them to let them know, hey, I'm coming and these are the symptoms I have. Is that generally it?
That's correct. The other option is there are hotlines through the city of Houston as well. Those have been very important to give people options, particularly people who don't have primary care physicians already, that they have an option to contact the city to see what the next steps should be. But always contacting either the health system, the healthcare provider prior to showing up. Not only make sure that the patient stays safe and is given the proper instructions on how to proceed and what to do, but also keeps the health care staff and the other patients within the hospital stay safe so that they can prepare for their arrival.
Chris, you had a question?
No, it was the message popped up.
Oh,
So,
gotcha.
yeah.
Gotcha. And so, I mean, I know we've talked a lot about like the testing and so on and so forth. I'll come back to that in a second. But the main reason that we wanted to talk to you today is because there are all sorts of people that are putting out these claims that are cures or treatments for coronavirus. And we've seen all the letters from the FDA and the FTC asking them to stop. When you see stuff like that as a medical professional, how does that make you feel?
Yeah, it's frustrating because we want to do the best for our patients. We want to make sure our patients are safe and that they're getting accurate, scientific, data-driven information that gives them confidence in their healthcare system. And when they're given false information, it really weakens our healthcare system. It gives them false hope that these medications or these interventions are going to help prevent the spread of the infection, prevent them from getting the infection in the first place. And there's just not any scientific data to support those interventions.
And obviously no vaccine yet.
No vaccine yet. Yeah. So multiple groups are working on vaccine development. Some getting close to or in clinical trials. Currently, also certain antivirals that are being evaluated in clinical trial and being used on compassionate basis in certain instances when needed.
Gotcha. actually just heard from the president not too long ago, right, about expanding the options for drive-through testing. In your opinion, is that a good thing? Is that something we need? Is that something that we should wait on, or should have been done a while ago? Or what's your thought on all that?
Yeah, so expansion of testing is critical to understanding the extent of the infection and the extent of transmission within our community. And what that means is that we can know who is infected, quarantine that person, and also do contact tracing to see who else might have been in contact with that person to isolate them as well. It helps contain and get a greater understanding of what the extent of the infection is within our community. It allows people to get the treatment that they need, the testing that they need. Doing drive-through testing has been used in other countries like South Korea, which has been able to test thousands of people, which has helped them with their disease control. The reason that is helpful is because it's high throughput, so more people can be seen, and it protects both the patient, the one who's ill, and patients who are in the waiting rooms for other reasons at doctors' visits, as well as the healthcare staff, the nurses, the front desk folks, as well as the physicians and healthcare providers. So we've seen benefits of the drive-through testing centers in other countries that have been incredibly beneficial.
Just to clarify, so that I make sure, I don't want to make any assumptions. What I've heard is that that kind of testing is like it's a nose swab and a throat swab, right? Is there anything else to that testing? I mean, obviously
no.
that sample gets sent off, but
right. So they do what's called a nasopharyngeal and an oral pharyngeal swab to try and detect the virus.
Got it. Okay. Gotcha. And I mean, working in the Houston area, do you think that, we've got is the Houston Health Department that's the one that's able to test without sending them off to the CDC?
Right, and there's commercial labs as well. So a lot of health systems are using the commercial laboratories, LabCorp and Quest, that have their own testing abilities currently now. There's also certain health systems that have their own testing that's being used in addition to the health department.
This is such a time where we've been trying to really focus on making sure, and the phrase has now kind of become cliche, but we call it facts, not fear. We try to do that with everything that's, massive and widespread like this. What do you tell your patients who come in and say, hey, I'm really scared about this?
Yeah, these patient visits tend to be longer nowadays because we're trying to provide a lot of reassurance to our patients. I have a lot of patients that don't want to come into the office, which is okay. What we do in those situations is we talk on the phone and make sure everybody's okay and that their concerns are met and discussed. So that is an option that we're doing as well, especially for those people who just don't want to come in and don't want any risk of exposures. But while we're here, we talk about precautions, things that the patients can do to prevent getting infected, especially their families, because most people come in concerned about their families, their loved ones who are either elderly or in that vulnerable population group. And they want strategies as to what they can do to prevent themselves and their families from getting sick. And so that takes some time, and that's what our profession does. We invest in our patients. We care about our patients. We want to make sure that they stay healthy and are confident in the approaches that they're taking to keep themselves healthy.
I know we've kind of bounced all over the place as far as the questions. Is there something more about the fake treatments that we haven't covered that you think is important to mention? I know the one that was talked about a lot was like colloidal silver. I don't know. Is there more to talk about that, or is that getting too in the weeds?
Yeah, I think there's a lot of different remedies, over-the-counter remedies, herbal remedies that people have used historically even for colds. So we've heard about things like zinc and vitamin C and those types of remedies that are sold over the counter, additional to other alternative mechanisms for prevention and treatment that have been proposed. And what we know in the scientific literature is that these interventions do not prevent infection. Some may reduce the duration of symptoms, but the incidence or the ability to acquire the infection is not changed. And so looking towards our scientific guidance, which is through the National Institute of Health, so they have a Center for Complementary and Alternative Medicine, and you can read on their website specifically saying that these remedies have not been scientifically proven to either reduce the incidence or duration of symptoms for this SARS-CoV-2 virus that we're seeing.
Okay, so basically the long story short is, while zinc and vitamin C might reduce the duration for other colds, they're not doing so for coronavirus. Is that right?
We don't know if
they
do or not.
Right, too early to
know
tell.
that most of those are tested on rhinoviruses, which is the other type of common cold, and that it could reduce duration in certain individuals, but it certainly doesn't reduce the incidence, and we don't have any information on the coronavirus. So at this point, there's no scientific backing or scientific data that these interventions will make a large difference within our community.
And is that because it's too early on in this virus to know?
Yeah, there's not a lot that we know about the virus to begin with, so some of these more alternative approaches aren't going to be the first thing studied, but we do know historically through the other coronaviruses that we've seen, SARS, MERS, as well as the endemic coronaviruses that we have each year that cause common colds, that these alternative or complementary approaches have not shown a significant improvement in prevention and or treatment of the viruses.
Gotcha. And I meant to ask you, are you guys able to test for coronavirus at Baylor College of Medicine?
Yeah, so Baylor staffs multiple different hospital systems. So we staff Texas Children's Hospital, St. Luke's, the Harris County system, and each one does things a little bit differently. So we're currently using commercial testing for Harris Health, and then each of the systems do things a little bit differently. Okay. But testing is available, yes.
Gotcha. What do you want to pass? What have we not covered that's important to pass on to the public, in your opinion?
I think the biggest thing the public needs to know is that, protecting yourself, but also protecting your neighbors is critical. So making sure you're making decisions that will be beneficial for the entire community is really important. And this is what's been termed in trending in the media as the flattening of the curve, is to use social distancing to separate yourself if you're sick so that you don't infect your neighbor and it doesn't spread throughout the community. And I think our Houston community has been doing a really great job making those sacrifices.
Okay. Chris, did we leave something else?
No, I mean, just, anything that you want to add that we haven't asked? I mean, you just kind of answered that question. So, no,
yeah. You feel good?
Yeah, I think that's good for me.
Doctor, just remind me how to say and spell your first and last name. I think I've got it, but I want to make sure I get it right.
Yeah, no problem. My name's Jill Weatherhead. It's JILLWEATHERHEAD.
Gotcha. And what's the appropriate title for you for your professor of tropical and infectious disease with Baylor College of Medicine?
That's correct.
Okay. And
yep.
Okay, you feel good?
On a